Some of you may have visited a doctor here in Japan complaining of neck pain and been told by said doctor that you have a straight neck or flat neck. Now, for much of human civilization's history, we used to think that the earth was flat, but in more modern times we've obviously come to realize that this is not actually the case. And I think it's a similar type of thing where doctors here in Japan still appear to be obsessed with this concept of a flat neck being the main cause of someone's pain. Now, when we use this term, or when doctors use this term, what are they actually referring to? Our spines essentially have natural curves that allow for load distribution throughout the system, attachments for different muscles, articulation with other bony segments, and placement of important organs. However, not everyone's spine looks like something out of an anatomy textbook, and the size of these curves will differ dramatically between individuals. The flat neck or straight neck, which is sometimes also referred to as military neck, refers to a decrease in the cervical lordosis, or the Ford's curve of the neck. And secondary to this loss of curve is often blamed for the much demonized Ford's head posture. Now, even though differences in structure and posture may predispose people to slightly more joint loading in certain areas, there's minimal research linking postural deviations with pain. Usually, if you have a flat neck, unless you're at an age where there's been significant joint deterioration, or if you've had a surgical procedure or a major infection, that structural shape of the neck has been there since childhood. And so if you've started to experience neck pain, it's highly unlikely that it's because of this structure. What's problematic is that if you Google flat neck, some of the things that come up are, excuse my French, fucking horrific. The WebMD's description of this condition includes an increased risk of swallowing difficulties, trouble breathing, spinal cord compression, and vision problems. And I quote, "In severe cases, your chin might eventually rest on your chest. Your neck might also put pressure on your spinal cord roots, leading to other problems, including weakness in your arms and legs, loss of control over bowel and bladder, and paralysis." Now, nerve compression can be a serious issue and is something that we do test for in people with neck pain. However, this is not something that is caused by this type of postural deviation. The problem is, as I've discussed in previous forums, people's belief about their pain can directly impact their condition. So having garbage information like this out there is, in my opinion, quite hazardous. In the episode that we did on neck pain, we discussed many of the things that can contribute to neck symptoms, including psychological factors, muscle strength, eye and jaw function, balance, as well as local joint mobility. And with any type of pain, this is all multifactorial, and there is rarely one factor that is responsible for one's pain. And to put this down to a loss of curve in the spine really makes no scientific sense. So if you have been diagnosed with a straight or flat neck, please don't stress out about this. It's completely normal, and if you are experiencing neck pain, there are so many other likely factors that can be addressed through a rehabilitation program. If you need some advice or guidance on this, please don't hesitate to come and see us. Thanks for watching.